The economic effects of the lockdown will plunge this country and the West into a recession, and the longer this goes on, it could turn into a depression worse than that seen in the 1930s. With mass unemployment, rampant inflation, severe austerity, less tax revenue, less to spend on our health service, less on housing, education and pensions. This will all cost lives, lives that are not so easy to quantify without a daily death toll listed on websites, but real even so. Meanwhile, unless drastic action is taken, we the West pull the plug on China, boycotts them with severe sanctions, then China, as a direct result of this crisis, will overtake the USA as the world's richest economy and become the world's main superpower. Communist China will dominate the whole world, and what they say will go. We are on the edge of that becoming a reality. Already they're trying to exert soft power by offering their assistance in the form of their faulty medical products to afflicted countries. For the West, these events have the potential to be like our asteroid, the one that wiped out the dinosaurs. The reason why we face this existential crisis is obviously because of the lockdown, which has closed our economy. I'll remind you. The Great Depression resulted in roughly a 9% reduction in GDP. The 2008 recession, it was just over 6%. Every month our economy is closed by the lockdown, it'll cause potentially an 8% fall in GDP. Even if the lockdown ended today, we're going to take a bigger hit than the 2008 recession, that is for sure. Some people I have seen have been saying, why are you going on about the GDP? Well, the GDP is a gross domestic product. It's what we produce as a nation. If it falls, we have less to spend on our health service, on pensions, and that will result in people dying younger. Pensioners being active increases their life expectancy, going to golf courses and going on cruises and little holiday breaks to cathedrals and so on. If pensioners aren't able to afford to do these things, their death rate will go up. If GDP falls relative to other countries, we become weaker, less able to defend ourselves and our interests. We'll be pushed around. That is why GDP is important. I think some people who describe themselves as nationalists think they can be poor but happy, living in splendid isolation from the rest of the world. It isn't like that. If we become impoverished, life will be miserable, laborious and short for many people here. Should we welcome this collapse in order to hasten political change? Will it open political possibilities? Will times of hardship herald the age of the sword? Would our nativist character rise to the fore? Who knows? I can hear in my mind some suggesting this in the darker corners of the interweb. Sit back and wait for the collapse has long been an excuse for inaction. And the armchair brigade, to whom activism doesn't stretch beyond what they do on their laptop or their smartphone, are invariably those who relish Armageddon. But politically, being seen to welcome disaster, it isn't good optics, need I say. But in any case, the outcome of a hypothetical collapse would be unpredictable. Would it make things worse? Would we end up under some form of Chinese occupational government? Under a puppet regime, perhaps? Anyway, back in the real world. The Boris Johnson government's first reaction was to avoid lockdown while protecting the vulnerable groups, the elderly and people with serious health issues. Meanwhile, the rest of the population, who are barely susceptible to disease, although I'm aware that some otherwise healthy people do die, would carry on and develop herd immunity. Maybe as many as 80% of the people or so develop very little or no symptoms at all. So once the overwhelming majority of people in the non-vulnerable group has had the chance, the chances of the vulnerable group getting it become minimal. That would allow economic activity to continue and avoid the lockdown. Why did they abandon this strategy? I'm not going to give any credence to conspiracy theories on this blog, and I'm not going to start now. So I won't be discussing any outlandish theory that was part of a secret scheme by the banksters to take over small businesses, or a preconceived plan to bring in a dictatorship, or anything like that. All that was related to 5G. The coronavirus is really a 5G related illness, and it's used to cover up for it. Urban myths are spreading like wildfire because we're in an unfamiliar environment, and the internet facilitates the spread of these stories. But on one level, conspiracy theorising is positive because it stems from a mistrust of the establishment narrative. Skepticism can be healthy, and it's not mad to be distrustful. And I'm well aware that many distant voices, the people who like to rebel against the system, are drawn to conspiracy as a solution, so perhaps I shouldn't say anything about that. But one or two of these theories, I'll say a few words. The British public, and from what I can see, the public throughout the West, has shown itself to be very easily controlled and subdued, easily put under house arrest and willing to give up their basic human rights. The police has shown itself to be more than willing to act in a draconian manner and as an arm of government repression. While I don't think this is why these measures were brought in, the establishment will clearly take note of this for future reference, and that is a sinister development. As far as this outbreak being linked to 5G is concerned, if this was the case, it wouldn't be contagious and would be an ongoing problem. The lockdown would have no effect, and there'd be continuous bouts of this sort of illness for as long as 5G is around, and ongoing large-scale deaths, as there'd be no cure. There'd be no possible vaccine, as it wouldn't be a disease or a virus. Also, in Iran, there is no 5G network, and so they shouldn't be affected, but they were one of the first countries affected by the coronavirus. Most of this country currently has no 5G network. It's very localised. Our 5G rollout has barely begun. Italy has got an even smaller 5G network than we have, and they've suffered worst of any country in the world. The town of Bergamo, which is the epicentre of the outbreak, has no 5G. There's no 5G in that town yet. South Korea has the biggest 5G network in the world, yet they've got a grip of the infection. So whatever issues there are related to 5G, for example, the involvement of the Chinese communist company Huawei, or associated with being too close to the masts, health issues perhaps, the theory that coronavirus is a fiction and that it's really a 5G illness holds no water. So going back, why did the Johnson government shift from their original herd immunity approach? Well, I think they bottled out of it.
And thank you for joining us for our daily briefing in the fight against COVID-19. I'm joined today by Professor Steve Parris, Medical Director of NHS England. I'd like first to update you.
They seem to be standing on their own in Europe. Actually, Sweden developed a similar strategy, but and have done no worse out of it than anyone else. But they seem to be alone. We live in an age of sensationalised news agenda, where the media like to hype up and always have. They learnt that during the Jack the Ripper murders. The media is in fierce competition with each other for these scare stories, and they made the government look like they were blasé and unprepared, fiddling while Rome burned. Any death would have been blamed on the government, and deaths were unavoidable no matter what approach was adopted. And because our political system is very reactive to the news agenda, the Boris government couldn't face the prospect of being blamed for these deaths when they were seen to be not doing anything, ignoring advice. They were seen to be putting money first, and these were indeed the arguments put forward, more concerned over money than they were over life. It was also easy for them to change tack because everyone else was doing it. All the rest was Europe was doing it, apart from China. China wasn't, and so they could take an economic hit relatively easily. Also, there are ridiculously alarmist predictions about the likely outcome, with 500,000 deaths suggested as a possibility in a now discredited projection put out by Imperial College. That alarmism caused panic. The person who modelled that 500,000 prediction has since revised his figures for the UK to 20,000, which is an average yearly mortality rate for the flu. Anyway, bounced by private organisations taking unilateral action like the Premier League, which counts its fixtures, and by windy Tory backbench MPs and the rest of the EU shutting down, clearly Johnson didn't want to be out of step, and then he went for the lockdown. The nearest comparison to this in my lifetime, as I am too young to have been in the war, from the 70s when they brought in the 3-day week and power cuts, and there was water shortages caused by the drought. There was no internet in those days, so no wild conspiracy theories were prevalent or claims that the government engineered either crisis. With the drought, for example, everyone was told not to take deep baths and to share water. I remember queuing up with my siblings to get into a shallow bath. The water wasn't supposed to be used on the gardens, but my dad fixed up a hose to the used bath water out into the garden to water the flower beds. And there were no helicopters going around to impose a no hosepipe rule. We were a high trust society back then. Now we live in a dystopian world where the slightest crisis leads to a police state. Incidentally, there's an interesting study done of the 1976 drought in Birmingham that found that it led to a 30% increase in the daily death rate, mainly elderly people with heart and circulation problems. There was a big death rate increase during that time as well. Anyway, besides the police lockdown, an increase in draconian powers and the fall in GDP, we have to weigh up other health issues concerned with the lockdown. For example, normal regular health and medical activities have virtually ended. Everything has been put on hold in order to deal with the coronavirus outbreak. What gets the publicity gets the attention. Treatments and preventative measures for other illnesses have all but ceased. You can hardly see a GP, and our hospitals have been emptied in anticipation of the coronavirus arriving, coronavirus victims arriving. And a government health advisor said this might be going on for 6 months. This will all cause more deaths. I'm now going to go into some statistics, which seems like a very impersonal thing to do at a time like this. They're grim statistics, but we have to understand whether or not this lockdown is justified. Statistics are important to put this crisis into perspective due to the panic and hysteria that the media is creating. Up to the 20th of March this year, we have had 5,000 less deaths than the 5-yearly average. In other words, this had been a low death year compared to usual by 5,000. The coronavirus has got to get a lot worse for us to meet the average deaths per year. The number of deaths per month always fluctuates widely. These figures are from the Office of National Statistics for England and Wales. In 2018, the highest monthly deaths were in January. It's always January because it's cold and there's a winter and flu, and there were 64,000. The lowest was September, 37,000. That's a difference of 27,000 deaths between January and September. In 2019, again it was January. 2019, it was 54,000 deaths. That's 10,000 less than the year before. There's always these disparities. And the lowest was 38,000, which is more or less in line with the year before, but with a different month. It was June and not September. In Italy, the death toll is getting near 15,000. But a government expert there reckons that 90% would have died anyway. They died with coronavirus in their system, but they didn't die of coronavirus. They had other ailments. That's only, I say only, that's 1,500 extra. 1,500. There are media scare stories about young people getting it. This is tragic for the families concerned, but you always get statistical outliers. And tragically, a few otherwise healthy middle-aged people will also die of it. But that's the same with flu or pneumonia, unfortunately. The media dwells on these cases, and that gives a false impression. Across the world, the overwhelming majority of victims are people over 70 with pre-existing severe health conditions that affect their respiratory system and their heart. Japan hasn't had a lockdown, has hardly tested anyone, and yet they have a tiny number of deaths. Sweden has no lockdown, just a sensible precautionary measures, and they've suffered no worse effect than any other neighbouring comparable country. My conclusion is that the government was wrong to end the herd immunity strategy. I'm not going to advocate anyone breaks the law, and the law states that we should self-isolate and only go out for very limited reasons. But I'm going to suggest the government should end the lockdown within a couple of weeks at most, as soon as the peak has clearly passed. The vulnerable and at-risk groups should be kept safe and away from the general population. Flights from heavily infected areas should be banned, but we should carry on and get back to work. We should take immediate measures against China, trade sanctions, and make sure any British factories out there relocate. It'll be safer in the long term to get back to work than to carry on too much longer with this lockdown. Thank you. And don't forget to subscribe.